Let's talk about color theory. With color theory, when you take the lip blush training, it's actually going to be more details in terms of color theory. This is just a basic knowledge of color theory. So when we're talking about complementary colors, are colors that are opposite from each other. When in permanent makeup, all we use is really just complementary colors, colors that are opposite from each other. And this comes into handy when we are correcting colors. It's still good knowledge to know other ones too, but really all we're using is the complementary color that are opposite from each other on the color wheel. Okay, so in permanent makeup, we always apply this concept. So always remember, orange will cancel out blue, right? Red will cancel out green. Yellow will cancel out purple. This is basic concept, basic knowledge of color theory. And when you're working on brows, you're going to apply exactly the same concept, right? If you're working on, let's say, blue eyebrows, you're going to use the color opposite from it, which is orange, because that's going to cancel that out, right? If you're doing lips, if you're working with, let's say, blue lips, then you're going to use orange pigment to cancel out the blue in the skin or the lips, right? So this is basic color concept. Pigment theory, when we're talking about pigment, there is organic pigment, there's inorganic pigment, and there's hybrid pigment. Okay, so let's talk about organic pigment. The term organic here in tattoo has nothing to do with like living or like organic, right? The reason why it's called organic pigment is because it contains carbon and it's derived from lab. And carbon, it exists in all living. So in chemistry, it's called organic chemistry. Carbon has smaller molecule size, therefore it's easier to enter the skin. So if you're working with organic pigment, you will see that it enters the skin very easily. It also has a brighter and more vivid and intense in terms of like color. However, it's less stable and it's resistant to sunlight, chemicals, and humidity. It lasts longer. Okay, so therefore it could be harder to remove, and the consistency of it is thinner. If you're a new artist, I don't recommend working with organic pigment due to these reasons. Inorganic pigment is basically, it's iron oxides, it's from minerals. Okay, it doesn't mean that it's not organic. Inorganic, it just means that it's minerals, and minerals are found in rocks, minerals, metal oxides, quartz, like non-living things. And they were mined and washed and then manufactured into fine pigment, just like the organic right here. The color is less intense, it's more muted, it's more matte, it's more opaque, softer and sheer in terms of color. And so therefore they fade quicker. And it's also easier to remove, but the consistency is thicker. So therefore it could be harder to implant. So like when you work with inorganic pigment, it just takes longer to implant into the skin. So nowadays in permanent makeup, they have something called hybrid pigment. Actually, all pigments nowadays in PMU is hybrid. Like all pigments are hybrid. It's just that if that brand or that line of pigment is geared towards more towards organic or inorganic. Obviously, it's going to be a blend, right? It's going to be a blend between organic and inorganic. It's just a matter that if they have more of the inorganic percentages or more of the organic percentages in that bottle. Does that make sense? So I have used, let me see. Yeah. So I have used, when it comes to pigment, I have used different types of pigments over my years. I could say that I have tried LI pigment. I have used PermaBlend and all the lines within PermaBlend, and I use Hannafy. I really like PermaBlend and Hannafy. LI pigment, I also like how it fades over time. I just don't like the fact that it's more towards inorganic. So number one, the consistency is thicker. Number two, because the consistency is thicker and it's inorganic, so it takes a lot longer to implant the pigment into the skin. And if you're working with hair stroke, it's just so hard to like get that hair strokes nice and thin because it doesn't really go in as smoothly as the organic. Now that's just based on my experience. As you're kind of like learning more and like embark on your PMU journey, you might have a different intake, but that's just what I've found out throughout my years of like doing PMU, is that Hannafy and PermaBlend tends to have more of the organic side in their hybrid pigment. So therefore, it's easier to implant. And when we're talking about pigment, I wanted to also share with you something. Every time when you're testing out a new pigment line, it's going to take like at least a year, right? Because you gotta try it out, and then wait until the client comes back 5 to 6 weeks for their touch up, and then from there wait for them to come back in a year to see how that certain pigment line heals. Now within each pigment line, there's going to be like a lot of colors, right? So for example, if I'm using color A on two different people with two different undertones, it's going to heal differently on each person, right? And that's just within that's just one pigment. So in order for me to test to see how that pigment heal on different undertone takes time as well. So that's why I'm very cautious when it comes to pigments, because I don't like to switch and try out different lines of pigments and whatnot because of that matter, because it can be the same pigment, same color, but if I'm using on two different undertones, it's going to heal differently. I gotta learn how each color heals differently on each undertone, and it's only based on experience. There's no easy way to learn pigment and how to choose the color. Later on, when we're if you're taking the brow class, I'll share how to take the how to choose the right color for brows. If you're taking the lip class, I'm going to share with you how to choose the right color too. But when it comes to like choosing the pigment, it really just takes experience. It takes time. After each client, make sure you note down what pigment you have used on that particular client, so that way when they come back to see you in 5 to 6 weeks, you know how that pigment heals, that color heals. And then when they come back to see you in like a year, then you know how that color fades out in a year as well. When I first started it, like honestly, I didn't really have anyone there to show me like what pigment to use. I was literally just looking at the paper and like just guessing what pigment to use on the client. right? So, but in my trainings, I really try my best to provide as much post-course support to you as possible. So down the road, if you ever have any questions on like what color to use on like the client, always, have them send you like a selfie and then send it to me, and then I'll be able to guide you like what color to use. And then over time, you would learn how each color heals on each type of undertone. There's no easier way to learn when it comes to pigment. It's not like a cookie cutter where I'm giving you, okay, well, color number 1 is going to heal exactly like this. Color number 2 is going to heal like this. 3 is going to heal like this. It's very hard because based on the person's undertone, you kind of need to see how that color heals on them to predict, right, for the next clients who have similar undertone and brow hair or lip undertone, things like that. So through experience, you'll be able to learn how each color heal. Let's talk about anesthetics. Anesthetics is basically numbing. So when it comes to numbing, we use primary numbing and secondary numbing. There is a huge misconception out there that when you're using anesthetic, it's harder for the pigment to absorb into the skin, and that it changes the texture of the skin and whatnot. Honestly, I've been in this industry for 9 years, and ever since the beginning, I've learned how to work with numbed skin. So over time, I've developed kind of like, you develop like a feel for it. Like when you touch that skin, you already know what depth and what pressure you need to work with, right? So I really think that it just the matter of what you were trained with in the beginning. Now I know that like some trainings out there, they teach do not work with numb skin, so they don't numb. So if that was how you were taught in the beginning to work with, rare skin or like raw skin, no numbing, then obviously that, once when you switch to numbing, it's going to feel differently. Yes, the anesthetic, the numbing will harden the skin texture a little bit. So therefore, maybe you gotta stretch a little bit tighter. You gotta adjust your pressure a little bit. But I do think that it's all about getting yourself familiar with working with certain types of skin. For me, the client comfort is like my priority. If the client feels relaxed, they don't feel pain, they lay still for me to perform the procedure, they sleep, they snore, whatever, right? I feel more at ease in like engaging in my work, creating beautiful work. But when the client keeps moving because they feel pain, they're like all tensed up, and it just, to me, I can't work. I can't focus in my art when somebody is going through so much pain like that. And that's not including the types that are sensitive, the types that are sensitive, even with numbing, they still cringe, like they still feel it. So yeah, so to me, when the client is relaxed, I feel more engaged in performing my art. So I've learned to work with numb skin, and honestly, once when you really master it, it just like working with skin that isn't numbed, right? Because it's all about entering in the right depth, having the right pressure, whether it's numbed or not numbed, right? So you just, over time, you just feel your needle. It's like, how do you say, like when you're applying makeup, right? you're holding your brush and like, you could feel that you're going with more pressure with your brush or less pressure with your brush. Same thing with the needle, right? The more you do it, because the needle is so thin, so little, so obviously it's not like a brush that you can just feel it right away, right? But it takes time because the needle is so thin, right? So it takes time to really get a feel of the needle, like the more you work with the needle, the more you will develop that sense that, okay, well, once when it enters the skin, even when it just scratched the skin, you already can feel it at your fingertip of like how deep or what is the depth that you're going in, right? So it's all about practicing. So let's talk about primary numbing. Primary numbing usually comes in like a cream or ointment texture, and we numb the client. I usually numb the client 20 to 30 minutes prior to the treatment. During that time, I usually have them fill out the consent form while waiting for the brows or lips or eyeliner, well, not eyeliner, but lips or brows to be numbed. Eyeliner, I numbed for pretty much the same thing, 20 to 30 minutes before the treatment. Make sure you cover it with the saran wrap because it keeps the heat in there and it press against the skin, so it keeps the numbing absorb the skin even better. And if you're using prescription numbing, obviously it's going to be more effective and it acts a lot faster, so they don't have to sit there for a long time. But if you're using like a normal topical numbing, then generally it's 20 to 30 minutes before the treatment, and that's plenty. Honestly, I've been using TKTX for years, and yes, I numb clients 20 to 30 minutes before the procedures, and they're fine. Like, I get clients that come in that is so relaxed, some even sleep and snore. So this numbing is really effective. Lips can be a little more painful, like regardless of what numbing you use. Like, I use a prescription numbing cream for lip procedure at my salon, and yet the client still whine that it hurts. But lips, it's sensitive. If you're enrolled in a lip blush training, we will talk more about that, like why the lips is more sensitive. Secondary numbing usually comes in like a gel or liquid texture. Now, this numbing should only be used on broken skin, meaning that you should only use it during the treatment, because once when the skin is broken in, this numbing seep into the skin and basically paralyze the blood vessel even more, so they don't feel it. Because usually after so they don't feel it the first pass, but going into the second pass, if you don't numb again, usually they'll start feeling it. So usually the second pass, I'll numb it again, so that way it stays numb for like another good about 15-20 minutes. Okay, and you really don't need to apply like a lot. You just need to put like a normal thin layer over, and it seep right into the skin. Tools. Let's talk about some tools. This is really quick, but in permanent makeup, these are the essentials that you would need. Now, I have this all like in the workbook that you can print out or download, and then just kind of like go off of the list as a checklist if you're wondering what to buy and what not to buy. Obviously, the PPE, the disposable stuff like gloves, bed sheets, dental bib, gowns, hairnet. I usually get my disposables either on Amazon, eBay, AliExpress, or like in my case, because I have to like provide supplies for all of my artists, so I just order off of Alibaba because like I order in large quantity. But if you don't order in large quantities, then maybe just Amazon, eBay, or AliExpress is fine. You would need obviously your machine. I would recommend having two machines just in case, because I sometimes if you accidentally like drop one, you have another one on hand, because again, you know, if with machine, remember, like once when you drop the machine, it doesn't perform it as well anymore, because the motor in there is not does not work correctly anymore. And also just in case, you know, you never know what if like it's just stop working or whatnot. But with the machine, if any problems, you need to contact the manufacturer. The Master or Amy, you need to contact Dragon Hawk, which is the manufacturer on the machine, okay? Or you buy a new machine. You will need different sizes of needles if you're performing different types of procedures, because different types of procedures will have different sizes of needles. Obviously, different colors of pigments. There will be like some basic colors that come in your kit. But if you want to, you know, work on more types of clientele, I recommend to get different colors. And obviously, you need numbing, primary and secondary. Here are some of the supplies. Tattoo Glide, you can get it on Amazon. Pretty much everything you can get on Amazon. Some of the stuff here already came with your kit. So yeah, so this is just like a picture of what the bed, like the setup that OSHA wants, you know, your place to set up and look like. I do get it that in real life setting, it might not be the case, because we have like other stuff that we need to stack here and here, and we might have, you know, stuff here and whatnot. But this is, if you're taking the test, then this is literally what it should look like this.